All right, good afternoon, everyone. Thank you for joining us today. I'm so excited to dive into this topic about safety with sleep aids with you because I know this has been quite the year for all of us with sleep. So I imagine that this is a topic that many of us are very, very interested in. So I am joined this afternoon by two of my colleagues at the Washington Poison Center, Han and Dr. Phillips, and I'm going to turn it over to them to introduce themselves and tell us a little bit about what their roles are at the Washington Poison Center. Han, let's start with you.
Hello, everyone. Thanks for having me, Megan. I'm a pharmacist at the Poison Center and also a certified specialist in poison information, so I take call at the center.
And Dr. Phillips?
And I'm Dr. Phillips. I'm a physician that specializes in medical toxicology, and that's dealing with poisons. And I'm the interim director of the Washington Poison Center. So thanks for joining us today. We're going to have some great discussions.
Yeah, thank you both for joining us today and providing your expertise on this subject. So, Dr. Phillips, I'm going to start out with you. Can you just set the stage for us today? Why are we talking about sleep aids? Why is a Poison Center addressing the topic at all?
Well, it's a really important and really common problem with sleep disorders in America. There's probably about 70 million people in the United States that have some form of diagnosed sleep disorder. And that's diagnosed. And it obviously changes with age. So the older you get, the more likely you are to have sleep disorders and the more likely you are to use sleep medications. So for example, if you're in your 20s, about a little less than 2% of people might use prescription sleep aids. But if you're over 80, as much as 7% of the population uses prescription sleep aids. Now, of course, most people use non-prescription sleep aids, and we're going to talk about both prescription and non-prescription. And if you look at all types of sleep medications people might try, it's as high as a third of the population uses some form of sleep aid in the previous month in order to help them sleep at night.
Wow, that is a lot of people. I had no idea it was that high. And I can imagine it's just been increasing with this past year and all of the stress. Yeah. And
I'm going to let Han pick up because I'm getting a call from the Poison Center to answer a helpline right now.
No problem. All right. So Dr. Phillips talked about how there are a couple different sleep aids out there, more than a couple different. There are a lot of different. So Han, can you just give us a general explanation of what sleep aids are first?
Yep. So sleep aids are designed to help promote sleep and to prevent insomnia. Some sleep aids can be bought over the counter. Others are prescribed by a doctor. In either case, these medications are meant for short-term use. The over-the-counter medications are for occasional sleepless nights and are not considered habit-forming. Some prescription medications treat longer bouts of sleeplessness, can be habit-forming. Some examples of prescription medications used to treat sleeping problems include benzodiazepines, some antidepressants, and some antihistamines. So I can talk about those medications later on.
Yeah, go for it.
Yep. So the common prescription medication sleep aids are hypnotics, such as Ambien, benzodiazepines, such as triazolam, temazepam, or antihistamines, such as Vistaril. Ambien, Lunesta, are more selective and only binds to part of GABA receptor in your brain, which leads to sedation. Benzodiazepines are less selective of which GABA receptors they bind to. And then also antidepressants that are used for sleep, such as trazodone or mirtazapine, work by blocking serotonin and histamine receptors to promote drowsiness. And then there's Ramelteon. It's a melatonin receptor agonist. It binds to the melatonin receptor stronger to promote sleep than normal melatonin supplement. And then Benadryl or other antihistamines work by blocking histamine receptors, which leads to sedation.
Great, thank you. That was a really thorough explanation of all of the different prescriptions. So we are going to talk a little bit more about safety considerations for all types of sleep aids a little bit later on in the stream. But there are definitely some risks that are specific to note with prescription sleep aids. So Dr. Phillips, welcome back. Can you share a little bit on those specific risks?
Yeah, you can never predict when you're on call when the phone will ring. So my apologies for that interruption. Well, I think the most important thing is to always use these medications like all medications. Take them as directed. Don't invent your own schedule. Don't invent your own doses. Take it exactly as it appears on the label. Don't share this medication with others. So if they're prescribed for you, only you should be taking them under the direction of the provider. And of course, don't mix it with other medications unless you've cleared it with your pharmacist or physician. And of course, that includes alcohol. Please do not drink alcohol and take these sleep medications because it's really a double whammy. It really knocks people down and it can really impair your breathing and can be life-threatening in some cases.
Thank you for sharing all of that. And again, we'll talk a little bit more about some broader considerations after we dive into the next category of sleep aids, which would be those over-the-counters. So Han, I'll turn it back over to you for that.
So for over-the-counter sleep aids, we have antihistamines such as Benadryl or diphenhydramine or Unisom, doxylamine. There are also dietary supplements such as melatonin. It is a supplement that is modeled after a hormone that's already made in the body and is used to raise your body melatonin to trigger the body to go to sleep. And then there's also valerian root that can also be used to help with sleep. It has a mechanism of action similar to benzodiazepines. It also binds to GABA receptor in your brain, but it does not produce as strong of effects. And L-theanine is a water-soluble amino acid found in green tea and mushrooms. It can have mild effect on GABA and serotonin, which can promote sleep restfulness. And then we can't forget about GABA supplement, which is not as effective as the GABA your body naturally produces because a large amount of it is broken down before it reaches your brain. Then there are also sleep aids that have a combination of some of these, like Pyrzes, that has fusion of homeopathic ingredients like ashwagandha, chamomile, lemon balm, valerian root, and lavender.
And folks, we're throwing so much information at you. I should have said this earlier. If you have any questions, please write them in the comments section and we will be sure to address those. So Han, what are some of the risks associated with these over-the-counter sleep aids?
So most dietary supplements are not regulated by the FDA, so they have questionable purity and quality. So you have to be aware of that. Another risk is a lot of sleep aids can cause next day grogginess. And also keep in mind that tolerance to the sedative effects of sleep aids can develop quickly. So the longer you take them, the less likely they are to work or make you sleepy. A lot of these medications, over-the-counter sleep aids, can interact with the medications that you are on. So make sure to check with your doctor or pharmacist before taking them. And like Dr. Phillips mentioned earlier, I would recommend to avoid alcohol because it can increase the sedative effects of these medications. Older patients should be even more cautious because over-the-counter Benadryl or doxylamine can increase confusion and fall risk. And if you're at risk of a certain type of glaucoma or urinary retention problems, I would recommend to check with your doctor before trying diphenhydramine, doxylamine, or any over-the-counter medications, as some of them, especially antihistamines, can worsen your current condition.
That was an excellent segue into the question that I have for Dr. Phillips then on if sleep aids are safe for everyone to use or if there's certain populations that really need to be careful beyond what Han has just outlined.
Yeah, there's certainly populations that are more at risk. Some sleep aids, prescription or non-prescription, are not recommended for children. And it's always important to check with the labeling of them and check with your pharmacist before you consider doing that. Sometimes that's because the research has not been done to find out whether they're safe or not in children, or there just may not be any information at all. So be very cautious with children and sleep medications. We see that all the time, and I know Han mentioned melatonin. We see melatonin gummies, for example, I would say almost every day in the Poison Center, called really common, because they taste great and kids get into things. So the other categories would be older adults, particularly risks like daytime sleepiness. You kind of have this hangover like effect, and that really impairs your cognitive ability, your ability to think and process thinking. And of course, that becomes a huge risk if you're driving a car or operating some other type of dangerous machinery. You have to be very cautious about this hangover effect that we see very commonly with the antihistamine categories and some of the prescription um, benzodiazepine medicines. The Z drugs is a common group that we talk about sometimes. There's also interactions between many of these, and oftentimes people will already be taking medications that make them sleepy, and then taking this on top of it. It really adds up. So, and the big risk, just in general, besides driving, is fall risk. And Han mentioned this, and falling results in fractures. And this is actually a very common way that people have very serious and even life-threatening problems. They have a hip fracture, then they get pneumonia, and it's common that people can pass away. So we take fall risks, what we call ground level falls, incredibly seriously, and it's really an important thing to watch for these medications and avoid them, and have your pharmacist go over your medication list and look for these interactions and look for this kind of risk that population, and particularly the older population, might get.
Excellent. Thank you, Dr. Phillips. And just as a heads up to all of you viewers, we do have a lot of medication management resources that are available through the Poison Center, like a medication list development guide and list templates. And so it's really important that you're including any sleep aids on that list. So you are welcome to utilize the resources we have, the materials that we have created for folks. I will put that link in the comments for you to be able to download them. So Han, we heard about melatonin gummies, and I'm sure that there are lots of other common scenarios that we are hearing, that you are hearing in the call center. So can you tell us a little bit more about those?
Yes. So each day I get at least a call regarding melatonin ingestion, and most of them are from parents calling about their kids getting into a bottle of melatonin gummies and ingest like a large amount of it. In most cases, these children are unharmed. However, it is important to keep all your medications away and locked up so kids cannot get to them easily. Another question that I usually get to is they took the maximum recommended dose. Can they take another one? I always recommend to always follow instructions on label. And if you are at max dose and if it's not working for you, you need to find an alternative, because it's likely the medication is not effective for you. It's also important to remember that sleep aids don't treat underlying cause of sleeping problems. So if over-the-counter medication is not working, I would recommend to consult your doctor. And then another common call that I get is they often ask if they can take diphenhydramine with another sleep medication or sleep aid to help them sleep. If you are, or if you've been using one medication and if it's no longer working for you, you have two options. You can take a drug holiday, which means you take a break from taking the medication for a few days, or you can discontinue taking the medication and start a different medication to see if that works for you.
Perfect. Thank you for that. So I know you're answering a lot of calls, you're talking to people who have had accidents with these medications. What are your top tips for making sure that they don't have those accidents? Han, we'll start with you.
Okay, so my first tip is to read the label thoroughly, follow directions, take take as directed and read all warning labels. Sometimes the direction can be confusing, so if you have any questions or if you are not sure, then please ask your doctor or pharmacist. And make sure to include sleep aids and all over-the-counter or supplement medications that you're taking on your medication list. Use a medication calendar or checklist to keep track of how often you have to use these sleep aids. You can also use a pill organizer to keep track of whether you've taken your dose today or not. But remember to keep your pill organizer in a secure place away from children and pets because they're not child resistant. And then also never share your sleep aid with other people. From a health standpoint, it can be dangerous to share sleep aids with other people because they may be safe for you based on your medications or medical conditions. So if you share with someone else, that can potentially harm them. And always keep your medications in containers, either original container or pill box. You could use different colored band around the bottle to keep the medication separate from those other household members, or use labeling on them and make sure all medications, including prescription, over-the-counter medication, are out of reach and of all the children living in and visiting your home. Last but not least, don't drink alcohol, like Dr. Phillips mentioned earlier. Take other sedatives with sleep aids because they can cause additive sedation. In some cases, can be dangerous. Sleep aids slow the rate of breathing while sleeping. Taking too many sleep aids at one time or taking them with other sedatives like alcohol can cause unsafe sedation and potentially even cause a person to stop breathing.
Great tips. And again, folks, the link to our different medication management resources, like the medication calendar Han referenced and medication lists, that is included in the comments section there. And you're also just welcome to call the Poison Helpline if you want information on how you can more safely take these medications. Dr. Phillips, how about your tips?
Well, I think, as Han mentioned, perhaps the most important thing is to talk with your pharmacist and try not to get your medications from multiple places. So it's best to go in, talk to your pharmacist. They'll educate you on the interactions and the risks. And that's really, really important. And every time you add a medication, as Han mentioned, make sure you get it on your list with your provider if you're in the hospital, because we consider these very important medications in the hospital and outside the hospital. So it's important to get them all on the list. And we try to reconcile that medication list every time someone comes into contact, either in the physician office or in the hospital. So that's really an important thing. I think another big area is to really understand the nature of your sleep problem. You know, why are you having this sleep problem? It could be that you have a sleep disorder, such as sleep apnea or hypoventilation syndromes. And taking sleep medications for those can actually aggravate them and make them worse. So it's really important that you understand why you're having a sleep difficulty. Don't just stack several different medications up because that's going to make it worse. That's really important. So I think things to keep in mind are what we call good sleep hygiene. And there's great resources for this. It's kind of simple, but for example, the CDC has a great website that talks all about sleep disorders and sleep health and sleep habits. And important sleep hygiene would include things like don't eat meals late at night, particularly if you have symptoms of GERD. Don't take them if you have sleep apnea syndrome. Try not to go to sleep with a TV, computer, phone, anything else that emits a lot of light because that's stimulating your brain even subtly. And then people do that, and then they try to take some pill form to shut it off. And the better idea is to shut off the thing that's making the light to let you sleep. And of course, medications that can disrupt your sleep patterns are things like alcohol, caffeine, nicotine. Those types of substances can really disrupt your normal sleep cycle. So it's a very important thing, and all of those things can contribute to this hangover effect the next day, this daytime sleepiness because you just haven't got a proper amount of sleep the night before. So it's medications and it's good sleep hygiene.
Perfect. And I just shared the link to the CDC page that Dr. Phillips referenced in the comments section, so you all can access it there. And just a final reminder that you are always welcome to call the Poison Helpline if you have any questions about sleep aids, what is safe to do, as well as if you have any accidents with them. Do you two have any further comments on giving you a call?
I think one last thing would be it's not just for poisons. We also can help you with drug information or sleep medication information. So don't feel like you have to have an emergency to call us. We're here to give you some help even when it's not an emergency.
Great, thank you, Dr. Phillips. And we'll stick around for another few seconds to see if there are any additional comments. You are always welcome to comment after we finish this live presentation as well, and our educators can get back to you with answers to your questions, or you can call the Poison Helpline. If you don't already have this phone number saved in your phone, please do so now. That way you are ready to give us a call if you ever need us. I'm not seeing any questions come through, so I'm going to end this stream. But Han and Dr. Phillips, thank you again so much for sharing all of your knowledge and your expertise with us. This has been a lot of great information and a lot of helpful information for people.
Thank you for having me.
Thank you very much.
All right, have a good day, everyone.
Bye.